After my first miscarriage, it was probably about 6 months post miscarriage, I went to my doctor because my cycle was MIA. After my miscarriage, I went from cycles every 45 to 60 days to no cycle. I was not ovulating. I felt so awful. I was exhausted all the time. I had anxiety and depression that I had never dealt with before. It was so hard for me to even want to get out of bed. I had terrible acne and terrible cramping and bloating in my stomach, things that I had never dealt with before. So one, I went to her asking, what do I need to be doing to be able to get pregnant when we start trying again in about 6 months, because I know I'm not ovulating. But two, I have all these things going on and I want to feel better. And I will never forget, she told me, you're perfectly healthy. She just assumed I was healthy because I wasn't overweight. She ran a set of labs. Everything came back as normal. We can just start letrozole since you're not having a cycle, and that will improve your chances of being able to get pregnant because you'll be ovulating more consistently. And nothing was talked about why I felt like garbage. Now, as a practitioner, this is the exact opposite of my approach, because one, the fact that I wasn't ovulating at all was a huge red flag. If you're not ovulating, there is a reason why. If you're not having a cycle, there is a reason why. That reason why I wasn't ovulating and having a cycle was also why I went out and have 2 more miscarriages. So ignoring that piece of it was a big deal. Then also same thing with the symptoms. The symptoms that I was having, the acne, the fatigue, the digestive trouble, all of these things were also signs for my body that it was struggling. I use symptoms as a huge part of the fertility assessment I use with my clients. Symptoms are our body's red flags of like, hey, pay attention to me, I'm struggling. And so we can use those as clues into what's going on under the surface to help you with being able to get pregnant. It's not a coincidence that when I started addressing the root cause to my miscarriages and to my irregular cycles, my symptoms cleared up. I don't deal with any of my symptoms anymore. I now have a regular cycle and ovulate regularly, and I was able to have a healthy pregnancy. The fact that those things happened at the exact same time is not a coincidence. This is just a prime example of how the approach to fertility is just wrong in standard practice, and why we do it differently around here, and one of the biggest motivators to redefining fertility care.